Your thought on using Reglan after 3 months?
Better on Reglan, then they're likely a good candidate for maybe G-POEM going forward. At my former institution, that was a group that we looked at for stimulators. That was kind of a high prognostic indicator that they would be a good responder to a stimulator. I think the interesting thing coming forward would be prucalopride, which is now approved in the United States for constipation, but appears to have some effect on gastric emptying time as well. And so that might be something interesting going forward for that.
What are the centers that do G-POEM here in Northern California?
I'm sorry, can you repeat that?
What are the centers that do G-POEM?
So Stanford is doing G-POEM, CPMC is doing G-POEM. I'm not sure about UCSF, but those are the local centers that are doing it.
With the G-POEM, you showed some subjective responses over time. Were there objective responses as well in terms of gastric emptying time?
They didn't look at gastric emptying. I think what's most important, along with the cardinal symptom index and the quality of life, but what was most important was the hospital admission and ER visit rate in that, and that was over 18 months. And there was significant improvement in that. And so, I think gastric emptying time we try and look at as objective, but even with stimulators and pyloroplasty, surgical pyloroplasty, a lot of the studies haven't shown improvement in gastric emptying time, just mainly improvement in symptoms. And so I think that's the main metric we've been looking at in these gastroparesis patients. All right. Thank you, guys.